Hello everyone and welcome back to Clinical Cousins YouTube channel, where you are going to learn today. You are going to learn how we breathe. So the important thing to remember here is that air can only flow where there's a difference in pressure. Now I'm going to explain what I mean by that. So to understand breathing, we are going to have to be masters of this equation. Now I know a lot of you just tuned out just because I said the word equation, but equations show the relationships between things. So we are going to break it down very, very simply so a 5-year-old can understand it. Now, flow, this Q here, is just another word for movement. So from one place to another. So what are we talking about? We're talking about moving air from one place to another, from out here to inside of our lungs. So flow is equal to pressure over resistance. Now, all this means is that pressure will increase flow, okay? So the two types of pressure that we're going to be talking about are our positive pushing pressures and our negative sucking pressures, okay? So what stops flow? What will actually cut off air moving inside of our body? Well, that's going to be our resistance that we're going to talk about. So what we want to do is we want air to flow in and out of our lungs so that we can shove that essential oxygen into our blood to be pumped around our entire body. But how do we do that exactly? Well, the air that's outside of us is called the atmospheric air and pressure, and it stays pretty constant. Now, our lungs are actually attached to a pleural sac. It's a double membrane. It has pleural fluid in the middle, but it's actually attached to our diaphragm muscle and our external intercostals. Remember, intercostal, between costal is rib. So our muscles in between our ribs. So when we activate these muscles, the lungs are expanded. The external intercostals pull our lungs open and our diaphragm pulls it downward. So what happens when we increase our lung volume like this? Well, we actually generate a negative sucking pressure. Remember, negative sucking pressure. So when the lungs expand like this, their pressure becomes lower than the atmospheric pressure in air, and the lungs are going to suck all that air in that we need. So what happens when our diaphragm and our external intercostal muscles stop contracting? Well, the lungs are very elastic, so it doesn't take energy on our part. It doesn't take effort to actually compress our lungs. They're going to snap back to their normal shape. So as the lungs collapse back to the normal, as they snap back, they're going to generate a positive pressure. So positive pressure is all around, and it's actually going to be reversed. So we have a positive pushing pressure, right? Negative sucking pressure, positive pushing pressure. So we are actually going to shove the air out of our lungs. So we get air to flow by this repetition of negative sucking and positive pushing pressures. Okay, so the lungs suck and blow the air out. But what about that pesky resistance to flow? This is the really clinically important part. So the most important thing to remember is that the diameter of the airways is most important. So to my guys watching this, it's not always about the length of the airway that matters, okay? When it comes to respiratory physiology, at least, it is the girth, it is the diameter, it's how wide that vessel is. So very, very quickly, our sympathetic drugs, like our beta-2 agonists, okay? I'm talking about albuterol. I'm talking about epinephrine. They're going to dilate our airways. This is a good thing. They're going to dilate our airways so we can get more air in and out. This is going to make them wider, girthier, better for airflow. So when we decrease that pesky resistance, we're going to increase our airflow. This is a good thing. Now, parasympathetic drugs that block beta-2 receptors or that activate muscarinic receptors, they're actually going to shrink our airways. They are going to undilate them. They're going to make them smaller, not as girthy, not as good for flow. So you want to give your patients some more airway girth, give them some epinephrine, give them some albuterol. As always, thank you so much for taking the time to learn with us today, and remember to like and subscribe for more content. Thank you.